This podcast is presented by the Centers for Disease Control and Prevention, CDC, Safer, Healthier People.
I am Dr. Samantha Williams, a research psychologist at the CDC. Today, I'm speaking with Nan Roman, the president and CEO of the National Alliance to End Homelessness. Nan, in today's society, why are people homeless?
The major reason that people are homeless today is because they can't afford housing. Housing is the driver in causing homelessness. There are other factors that also are involved, illnesses, including mental illness, chronic substance abuse disorders, physical illnesses, HIV/AIDS, also affect people who are homeless and may cause them to lose income so that they can't afford housing.
Can you put a face on who is homeless in the United States?
About half of people who become homeless every year are living in families with children. The other half are single adults. There are also a lot of youth who become homeless. We don't really have very good data on them or numbers. 80% of people who become homeless are homeless largely for economic reasons. They basically stay homeless long enough to find another place to live. They leave the shelter system and they never come back. About 20% of people have serious disabilities. They really can't get out of the shelter system without help.
What is your organization doing to help achieve the goal of ending homelessness, specifically chronic homelessness, over the next 5 years?
The National Alliance to End Homelessness is an organization that does advocacy at the federal level. We do public education, education of opinion leaders, education of people who provide assistance to homeless people, and we do capacity building among providers of homeless assistance. So in terms of ending chronic homelessness, we're working in all of those areas. In terms of federal advocacy, we're working on getting enough resources to go to scale in ending chronic homelessness. There are about 110,000 chronically homeless people. So to end chronic homelessness, we essentially need somewhere around 100,000 units of permanent supportive housing. Federal resources will be key in providing those housing units, so we work on trying to educate Congress and the administration about what those needs are. Permanent supportive housing has services attached, and one of the most difficult things for communities has been financing the services that go with permanent supportive housing. And HHS has been actively looking at this along with their partners at HUD, and we try to bring information to that discussion as well. One of the things we do in the education area is try to build the intellectual capital around solutions to homelessness. Ending chronic homelessness is often a very cost-effective intervention. The cost of the housing and services is often less than the cost of leaving people with serious disabilities on the street or in the shelter system. Homeless people are more ill, they consume more hospital days, they go to the emergency room frequently. They're also often incarcerated basically because they're having to live their lives out in public. They get incarcerated for what we call status offenses. So they end up costing public systems of care, particularly the healthcare system, a considerable amount of money. It's often less expensive to house them than to leave them homeless. I think that that's particularly an important thing to understand when the economy is challenging. In terms of capacity building, we also work with communities to try to help them figure out how to shift resources into permanent supportive housing, how to structure the creation of permanent supportive housing in their plans to end homelessness locally.
Nan, thank you for being with us today and for participating in the inaugural Public Health and Homelessness Symposium at CDC. If listeners would like more information about the National Alliance to End Homelessness, please visit www.endhomelessness.org.
For the most accurate health information, visit www.cdc.gov or call 1-800-CDC-INFO 24/7. This podcast is presented by the Centers for Disease Control and Prevention, CDC, Safer, Healthier People.
I am Dr. Samantha Williams, a research psychologist at the CDC. Today, I'm speaking with Nan Roman, the president and CEO of the National Alliance to End Homelessness. Nan, what effect will the Affordable Care Act have on homeless populations?
I would say there are two major areas that we're looking at. First, the health reform measures are very encouraging, and we're really excited about them. Lack of health insurance and health care is definitely something that impacts homelessness. It impacts it because people don't have health insurance. They pay a lot of money for needed health care, which leaves them too little to pay for housing. The fact that people will be insured will make it easier to finance some of those services through Medicaid. So there's a steep learning curve there for the current provider network, which really largely does not use Medicaid reimbursement. But there's a possibility to finance permanent supportive housing.
What policies are in place that will help end homelessness for veterans?
Policies can have an impact on ending homelessness among veterans. Veterans are overrepresented in the homeless population. The profile of homelessness among veterans is a little bit different than it is in the general population. More veterans are single than in the general homeless population. More veterans who are homeless have disabilities than in the general homeless population. So policies are very important to bring an end to homelessness among veterans in two areas. One, many veterans who are homeless really are chronically homeless or disabled, and they need permanent supportive housing. So we need to provide more permanent supportive housing for them. The Department of Veterans Affairs has not been involved much in permanent supportive housing. It's happening now through the HUD-VASH program, which provides housing and services. In terms of services, there will have to be policy changes as well, because homeless people, especially people with mental illness, addictions, and also illnesses and physical disabilities, have a hard time often accessing medical care through conventional means. They need a more consumer-oriented system, more available to them where they are, more linked to housing. The VA will probably be looking at how to provide medical services in a way that's more effective for homeless consumers over the next few years in order to achieve their goal of ending homelessness among veterans in 5 years.
What policies can help address homelessness in youth and young adults?
Homelessness among youth and young adults is probably the least well understood segment of the homeless problem. We don't have a lot of data on that. What we do know is that there seems to be a link between homelessness among youth and young adults and child welfare. It's not that being in foster care causes people to become homeless, but there's an overrepresentation of people with a foster care history in the youth and young adult homeless population. I think the solutions around that, as far as we know, and again, I don't think we have a lot of good research on this, seem to have caring relationships with adults, because so many young adults and youth become homeless in the absence of any adult because they're detached from their families or other adults. So creating meaningful relationships with adults is an important part of it. And as with all homeless people, housing is an important part of it. In youth, it's a little less about permanent housing, because permanent housing really means something different to young people, whether they're homeless or not. Young people tend to be more transient. So it can be a transitional housing model, but it needs to be a model with services that help them get the skills that they need to live independently.
Tell me about families who are homeless and how they differ from other groups.
About half of the homeless population is families with children. And we have been learning over the past, I would say, 5 years, a lot about what works to help them. This is largely an economic problem. And in terms of the characteristics of homeless families, again, they really don't differ largely from the characteristics of poor families. So they don't have more mental illness, they don't have more children, they don't have lower education levels. They really look pretty much the same as poor housed families. The focus is now on solutions for families with children is really to get them back into housing as rapidly as possible. Most families that become homeless are spending their time amassing the resources to get back into housing. When you think about it, if an apartment costs, say, $900 a month, you've lost your apartment, you want to get back into another one, you need first and last month's rents and deposits. That's at least $2,000 to get back into an apartment. If you had $2,000, you probably wouldn't have lost your apartment in the first place. So they're going into the shelter system or transitional housing basically to save $2,000. Often we're paying $10,000, $15,000, $20,000, $25,000 to house them in transitional housing while they save $2,000. Maybe we should just give them the $2,000, and that's increasingly what's happening. There's a federal program that was funded through the stimulus called the Homelessness Prevention and Rapid Rehousing Program, HPRP. It was a $1.5 billion program that was designed to prevent an increase in homelessness resulting from the recession. It was very focused on prevention. That was giving people money to pay rent arrearages. This has been extremely effective. Communities are learning how to do rapid rehousing and prevention, and I think that this will continue as a primary approach to family homelessness. There is a small percentage of families where somebody has a serious disability in the family that requires a more intensive services environment. It's essentially permanent supportive housing again. And there's new federal policy through the HEARTH Act, which is the HUD Homeless Assistance Program, upcoming that will allow us to do permanent supportive housing for families.
Nan, thank you for being with us today and for participating in the inaugural Public Health and Homelessness Symposium at CDC. If listeners would like more information about the National Alliance to End Homelessness, please visit www.endhomelessness.org.
For the most accurate health information, visit www.cdc.gov or call 1-800-CDC-INFO 24/7.